Hi, welcome to Professional Certifications channel. Let's break down RHIT exam preparation, one topic a day for focused and effective learning. Today's topic is technology adoption.
Definition: Technology adoption in healthcare refers to the process by which healthcare organizations, providers, and patients accept and integrate new technological tools, systems, and solutions into their operations and clinical practices. It encompasses the introduction of innovations such as electronic health records, EHRs, telemedicine platforms, mobile health apps, data analytics, artificial intelligence, AI, and various digital tools aimed at improving the quality, efficiency, and accessibility of healthcare services. The adoption of technology in healthcare is driven by the need to enhance patient outcomes, reduce costs, improve healthcare delivery, and comply with regulatory standards. However, successful technology adoption requires careful planning, training, and addressing potential barriers, such as resistance to change, cost constraints, and the complexity of new systems.
Key models of technology adoption. 1. Technology Acceptance Model, TAM. The Technology Acceptance Model explains how users come to accept and use a new technology. According to TAM, two key factors determine whether users will adopt a technology. Perceived usefulness, the extent to which a user believes that the technology will enhance their job performance or clinical outcomes. Perceived ease of use, the degree to which a user believes that using the technology will be free of effort. Example: a healthcare provider is more likely to adopt a new EHR system if they believe it will help them streamline patient documentation, usefulness, and find it easy to navigate and integrate into their daily routine, ease of use. 2. Diffusion of innovations theory. Rogers' diffusion of innovations is a theory that describes how new ideas, products, or technologies spread within a population. The theory categorizes individuals into different groups based on their willingness to adopt innovations. Innovators, the first group to adopt new technology. Early adopters, those who embrace new technology after seeing its benefits. Early majority, a larger group that adopts the technology once it is proven effective. Late majority, individuals who adopt technology once it has become widely accepted. Laggards, those who are resistant to adopting new technology and adopt only when necessary. Example: when a new telemedicine platform is introduced, a small group of tech-savvy physicians, innovators and early adopters, quickly start using it, while others, late majority and laggards, may wait until it becomes a standard practice across the industry. 3. Unified theory of acceptance and use of technology. UTAUT. The UTAUT model builds on TAM and adds more factors that influence technology adoption, including performance expectancy, the belief that using the technology will improve performance. Effort expectancy, the ease of use associated with the technology. Social influence, the degree to which important others, e.g., peers, supervisors, encourage the use of the technology. Facilitating conditions, the availability of support and resources to use the technology. Example: a hospital implements a new EHR system. Healthcare providers are more likely to adopt it if they believe it will help them improve patient care. Performance expectancy, find it easy to use. Effort expectancy, are encouraged by leadership, social influence, and have access to technical support and training. Facilitating conditions.
Key steps in technology adoption in healthcare. 1. Needs assessment and selection. Before adopting new technology, healthcare organizations must assess their specific needs and identify gaps in current systems. This involves evaluating which technologies will address these gaps and align with the organization's goals for improving patient care, operational efficiency, and regulatory compliance. Example: a hospital identifies that its current EHR system lacks interoperability features, leading to inefficient care coordination. After assessing the need for a more integrated system, the hospital selects a new EHR platform with enhanced data exchange capabilities. 2. Pilot testing and evaluation. After selecting a technology, organizations often conduct pilot tests to evaluate its effectiveness in a controlled environment before full-scale implementation. Pilot testing allows for adjustments based on feedback from users and helps identify potential issues early in the adoption process. Example: a clinic conducts a pilot test of a new telemedicine platform by using it with a small group of patients and providers, gathering feedback on its ease of use, functionality, and impact on patient satisfaction. 3. Training and education. Training is a critical component of technology adoption, ensuring that healthcare providers and staff understand how to use the new system effectively. Proper education reduces resistance to change, minimizes errors, and increases confidence in using the technology. Example: a healthcare organization provides comprehensive training sessions for staff on a new EHR system, including hands-on practice and support resources to ensure smooth adoption and reduce workflow disruptions. 4. Implementation and integration. During the implementation phase, the new technology is fully integrated into clinical workflows, operations, and patient care processes. This stage involves ensuring that the technology works seamlessly with other systems, such as billing, scheduling, and diagnostic tools. Example: a hospital implements a new clinical decision support system, CDS, into its existing EHR platform, ensuring that the CDS integrates smoothly with the hospital's workflows and provides real-time alerts for clinical decision-making. 5. Monitoring and continuous improvement. After implementation, organizations must monitor the performance of the new technology and gather feedback from users. This helps identify areas for improvement and allows for ongoing adjustments to optimize the system's effectiveness in meeting organizational goals. Example: a hospital gathers feedback from physicians using a new AI-powered diagnostic tool and continuously updates the system's algorithms to improve accuracy and clinical relevance.
Benefits of technology adoption in healthcare. 1. Improved patient outcomes. The adoption of technologies such as EHRs, telemedicine, and AI can improve patient outcomes by enabling better care coordination, reducing medical errors, and providing timely access to patient data. Example: a healthcare provider uses an AI-driven tool to analyze patient data and predict which patients are at risk of developing complications, allowing for early intervention and improved outcomes. 2. Increased efficiency and productivity. Technology adoption streamlines workflows, reduces the administrative burden on healthcare staff, and automates routine tasks, allowing providers to focus more on patient care. Example: an EHR system automates the process of entering patient information and generating reports, reducing the time providers spend on paperwork and improving clinical productivity. 3. Enhanced data analytics and population health management. Technologies such as data analytics, AI, and EHRs allow healthcare organizations to collect and analyze large volumes of health data, supporting population health management and helping providers identify trends and address health disparities. Example: a healthcare system uses data analytics to track population health metrics, such as rates of chronic diseases and vaccination coverage, and implements targeted interventions to improve health outcomes for underserved communities. 4. Better patient engagement and empowerment. Mobile health apps, patient portals, and telemedicine platforms provide patients with greater access to their health information, enabling them to take an active role in managing their health and making informed decisions. Example: a patient uses a mobile app to track their daily medication adherence, blood pressure readings, and exercise routine, sharing this data with their healthcare provider to monitor their chronic condition. 5. Cost savings and reduced waste. Technology adoption can reduce healthcare costs by minimizing unnecessary tests, streamlining care delivery, and reducing hospital readmissions. Automation and data analytics also help optimize resource use and reduce waste. Example: a hospital reduces unnecessary imaging tests by using clinical decision support tools that alert providers when a test is not needed based on the patient's clinical history. 6. Compliance with regulatory standards. Many healthcare technologies, such as EHRs, help organizations comply with regulatory standards related to patient data privacy, HIPAA, billing accuracy, and quality reporting, such as CMS requirements. Example: an EHR system with built-in HIPAA-compliant encryption ensures that patient data is protected from unauthorized access and breaches, helping the organization maintain compliance with privacy regulations.
Challenges of technology adoption in healthcare. 1. Resistance to change. Healthcare providers and staff may resist adopting new technologies due to fear of change, lack of familiarity with the technology, or concerns about increased workload. Overcoming resistance requires strong leadership, effective communication, and adequate training. Example: a hospital faces resistance from some physicians who are reluctant to use a new EHR system, preferring traditional paper records. Leadership addresses these concerns through additional training and emphasizing the long-term benefits of the EHR. 2. High implementation costs. The cost of implementing new healthcare technologies, such as EHRs or AI tools, can be a significant barrier, particularly for smaller healthcare organizations with limited budgets. These costs include purchasing the technology, training staff, and maintaining the system. Example: a small rural clinic struggles to afford the upfront costs of implementing a telemedicine platform but seeks grant funding to support the adoption of this technology. 3. Integration with existing systems. Integrating new technologies with existing systems, such as legacy EHRs or billing software, can be complex and time-consuming. Interoperability challenges can lead to delays in implementation and frustration among users. Example: a hospital implementing a new clinical decision support system encounters difficulties integrating it with their existing EHR, leading to delays in adoption and requiring additional IT support. 4. Data privacy and security concerns. The use of new technologies, particularly those that involve cloud computing or remote access, raises concerns about data privacy and security. Healthcare organizations must ensure that new systems comply with data protection regulations like HIPAA. Example: a healthcare provider implements a telemedicine platform but must ensure that all patient consultations conducted through the platform are encrypted and secure to comply with HIPAA requirements. 5. Training and learning curve. Adopting new technologies often requires significant training, which can be time-consuming and disruptive to clinical workflows. Providers may also face a learning curve when using new systems, leading to initial decreases in productivity. Example: a clinic experiences reduced efficiency during the first few weeks of using a new EHR system as staff members adjust to the new workflows and interfaces.
Best practices for successful technology adoption in healthcare. 1. Engage stakeholders early, involving key stakeholders, including healthcare providers, staff, and patients, early in the technology adoption process helps build buy-in and ensures that the selected technology meets the organization's needs. Example: a hospital forms a multidisciplinary task force, including physicians, nurses, IT staff, and administrative leaders, to guide the selection and implementation of a new EHR system. 2. Provide comprehensive training. Offering comprehensive training to all users is essential for ensuring successful adoption. Training should be tailored to different roles within the organization and include hands-on practice, ongoing support, and resources for troubleshooting. Example: a healthcare organization provides role-specific training for physicians, nurses, and administrative staff on a new telemedicine platform, ensuring that each group understands how to use the technology in their daily workflows. 3. Start with a pilot program. Conducting a pilot test allows organizations to evaluate the new technology in a smaller setting, gather feedback, and make necessary adjustments before full-scale implementation. This minimizes disruptions and helps address potential issues early. Example: a clinic runs a pilot test of a mobile health app with a small group of chronic disease patients, gathering feedback on usability and effectiveness before offering the app to all patients. 4. Ensure strong leadership and support. Leadership support is critical for successful technology adoption. Leaders should communicate the benefits of the new technology, address concerns, and provide ongoing support to ensure smooth implementation. Example: A hospital's leadership team holds town hall meetings with staff to explain the benefits of a new EHR system, listen to concerns, and provide updates on the implementation process. 5. Monitor progress and solicit feedback. After implementation, organizations should continuously monitor the performance of the new technology, gather feedback from users, and make adjustments as needed. Regular check-ins with staff help identify any challenges and ensure that the technology is meeting its intended goals. Example: a healthcare provider collects feedback from physicians and nurses using a new clinical decision support tool and makes adjustments to the system based on their suggestions to improve its clinical relevance. 6. Focus on interoperability and integration. When adopting new technologies, healthcare organizations should prioritize systems that can integrate seamlessly with existing technologies and support interoperability. This ensures that patient data can be easily shared across different platforms and providers. Example: a hospital selects an EHR system that supports interoperability with regional health information exchanges, HIEs, allowing for seamless data sharing with other healthcare organizations.
Future trends in technology adoption. 1. Artificial intelligence (AI) and machine learning. The adoption of AI and machine learning technologies will continue to grow in healthcare, with applications ranging from predictive analytics to personalized treatment plans and automated administrative tasks. Example: a hospital adopts an AI-powered tool that analyzes patient data to predict which patients are at risk of hospital readmissions, enabling targeted interventions to prevent unnecessary hospitalizations. 2. Wearable devices and remote monitoring. Wearable health devices and remote monitoring technologies will become increasingly integrated into healthcare systems, allowing for continuous tracking of patient health metrics and early intervention when needed. Example: a healthcare provider adopts remote monitoring devices that track patients' blood pressure and glucose levels, enabling real-time data collection and remote management of chronic conditions. 3. Telemedicine and virtual care expansion. The COVID-19 pandemic accelerated the adoption of telemedicine, and virtual care will continue to expand as healthcare providers integrate telehealth platforms into routine care delivery. Example: a healthcare system implements a telemedicine platform that allows patients to schedule virtual visits with their primary care providers, reducing the need for in-person appointments. 4. Blockchain for data security. Blockchain technology will play a growing role in ensuring the security and privacy of patient health data. Blockchain can provide a decentralized, tamper-proof way to store and share medical records, reducing the risk of data breaches. Example: a healthcare organization adopts a blockchain-based platform to securely store and share patient data, ensuring that only authorized users can access sensitive health information. 5. Cloud computing and data storage. The use of cloud computing for storing and accessing healthcare data will continue to grow, providing healthcare organizations with scalable, cost-effective solutions for managing large volumes of health data. Example: a clinic moves its EHR system to a cloud-based platform, allowing for easier data access and reducing the need for on-site servers and IT maintenance. 6. Augmented reality (AR) and virtual reality (VR). AR and VR technologies are increasingly being used in healthcare for applications such as surgical simulations, medical training, and patient rehabilitation. These technologies will continue to be adopted to enhance clinical practice and patient outcomes. Example: a medical school adopts VR technology to simulate complex surgical procedures, allowing students to practice their skills in a virtual environment before working with real patients.
Conclusion: technology adoption is essential for modernizing healthcare, improving patient outcomes, and enhancing the efficiency of healthcare delivery. By adopting tools such as EHRs, telemedicine platforms, AI, and wearable devices, healthcare organizations can streamline workflows, reduce costs, and provide more personalized care. However, successful adoption requires addressing challenges such as resistance to change, high implementation costs, and data security concerns. For RHIT exam aspirants, understanding the key models, steps, and best practices for technology adoption is essential for supporting the digital transformation of healthcare and contributing to improved care delivery.